Education is a progressive discovery of our own ignorance, and the purpose of medical education is to replace an empty mind with an open one. Medical education is not just a program for building knowledge and skills in its recipient, but it's also an experience which creates attitudes and expectations. The future of medical education holds many possibilities, and with each possibility unfolding in different way at variable pace for different people and organizations. To have a talk on future perspectives of medical education, I would like to call upon the stage Dr. Mumtaz Patel, who is MRCP, FRCP UK, Masters in Medical Education, PhD in Lupus and Nephrology, Consultant Nephrologist, Manchester UK, Senior Vice President, and Vice President for Education and Training, Royal College of Physicians, London, UK. She is currently Postgraduate Associate Dean for NHS England and is a Director for Conduct and Progress at the School of Medicine at University of Liverpool, and has recently completed her 3-year term as RCP Global Vice President. She has also worked as RCP Regional Advisor for Training and Clinical Lead for Quality Management for the JRCPTB. Dr. Mumtaz has established a strong track record in education, training and assessment and research. She has obtained her Master's in Medical Education in 2014 and leads on national research around assessment, differential attainments and professionalism. As RCP Global Vice President, she developed the global strategy, which has made a significant impact on our membership growth over the past 2 years, increased diversity, and established strong networks as well. She also launched a Global Women Leaders Program, which empowers female physicians to advance into the leadership roles. Over to you, Dr. Mumtaz Patel.
Thank you so much for the kind introduction. And lovely to be here again. I was here last year for delivering our Global Women Leaders Programme, and it's great to be back here to talk about the future perspectives for medical education and training. Thank you to Professor Akram, Soumya, and the wider PSIM team for inviting me, and I'm very grateful and honoured to be here. So I have no to disclose, and what I'm hoping to cover in the next 20 minutes or so is talk the importance of medical education, understand definitions around medical education and some of the key milestones, and acknowledge its purpose. Where does it fit in with regards to professional development and patient care? Talk a little bit around quality assurance frameworks, and then give an overview of the future trends of undergraduate and postgraduate medical education. And hopefully we'll have some time for question and answers at the end of the session. So what does medical education mean to you? And I think many of us here in the audience started off thinking about a medical career very early in our stages of life, and then from the undergraduate, from college to university to later into postgraduate world. And it's that lifelong learning, isn't it? It never ends. Even now, I think we're still learning from each other, as well as hopefully sharing some knowledge and expertise. And that journey of a learner, where does that start and where does that finish? I guess it doesn't finish, it's a continuum across. So I guess looking at here around the unconscious incompetence, you start by, you don't know what you don't know. I guess you start somewhere. And then you have a process of discovery, learning, within the different settings from medical school into the postgraduate world. And you get to the stage where you think, well, I know what I don't know. I know what I need to learn, but there's still lots and lots to learn. And I think I probably still feel that at times. And then you continue to learn, put more effort into it, and get to a stage of conscious competence. So I know what I know, a state of slightly being comfortable. But then when you get to the stage of unconscious competence, it becomes second nature. And I say that sometimes when I do my clinic, when I do some things, you can kind of just do things without thinking about it too much. And that in itself can have risks because, you could get to the stage where you think, I don't need to learn anymore, I'm absolutely fine. But particularly in meds, in our field, there's so much more to learn. We're not ever at a state of status, it's always a state of flux and change. So that reflective competence is extremely important to continue to reflect on our own practice, getting feedback from others, and then continuing that process of learning. So I think for me, it's never ending. It's never a state of kind of knowing everything. And I think if you get to that, that's when you may have trouble. So thinking about definitions, what are the definitions of medical education? There's lots of definitions out there, but I guess it's how you integrate that basic science into your clinical practice, ideally in a way which is kind of spontaneous, and you continue the process of learning throughout life. And what we're doing is essential to good medical practice. And like I say, it doesn't end, it's a continuum of learning. And in the UK, the GMC, General Medical Council, is our regulator. They set our standards, and the Good Medical Practice Framework has been something that we work on towards achieving, and we have the different domains in which we have to map our activity, which is important as part of our revalidation. This last Good Medical Practice Guidance has been in place from 2012 to 2023, and just this year it's been updated, which I'll go through the key updates on the next slide. But the domains are shown here. So you've got your knowledge, skills and performance, you've got safety and quality, communication, which is a huge part of what we do, partnership, team working in collaboration, and then maintaining trust and integrity, which again is a big part both with our patients but also with our colleagues. So what has changed? So there's been an update to the Good Medical Practice Guidance just recently, and it was launched in January. And then there's 5 key areas which have kind of changed. And I guess creating that respectful, fair, compassion workplace is really important. So these kind of additional terms have come into place, whether it's fairness, compassion, how we promote patient-centered care, how we tackle discrimination and champion fair and inclusive leadership. We've had a number of scandals, you could say, or issues with big hospital trusts, lots of kind of patient deaths, lots of kind of issues which have happened. And when you look through that with a Swiss cheese model of what's caused what, many of the times it's the culture which isn't right, it's the leadership which isn't right, and it's how can we make that better over time, and hence some of the changes in these domains reflects that as well. So the knowledge, skills and development are now new domains. Patients partnership, I think very important how we work across, both with our patients but also within our staff groups as well. And culture has been added in, because I think the culture of the organisations very much determines how people perform and also impacts on patient outcomes as well. And then that wider trust and professional behaviour. I think skills and knowledge is one part of being a doctor, but it's the professional values and behaviour, which is the bits that I see. So I do fitness to practice work within the GMC, and that's where we see a lot of problems where professionalism breaches have occurred. So just talking through some of the key concepts. So we know medical education is a dynamic process. It starts at the start of medical education very early in our careers, and it continues until a physician retires and even beyond active practice as well. And it consists of that training, ensuring physicians acquire both the knowledge, skills, behaviours and competencies, but allows them to practice both professionally but also ethically at the highest standards. And all physicians, you know, it's whose responsibility is it? Sometimes the medical educationalists will say, well, it's the universities, it's the deaneries, it's whoever. But I think it's a shared responsibility that we should all take, both as individuals, but also as organisations, to hopefully support our future generation of doctors. Some of the key milestones affecting medical education in the UK are shown here. So in the 90s, which is when I was training, shows my age, there was a disparity of what medical students were being taught and what they were expected to know within the exams. And in the early 90s, which is literally in the middle of my medical school career, the core curriculum came out so that all medical schools had to adhere to a core curriculum. And then tuition fees got introduced in late 1998, and they've steadily increased in amount, which sometimes, you know, restricts people from different backgrounds, particularly to enter into medical school, which I don't think is great. But, you know, certainly there are tuition fees now for medical school entry. And then the bigger other change that happened in 2003 was modernising medical careers. Those who were within it, it was complete chaos. But like a lot of change, the rationale behind the change was very good, in the sense of standardising national training, curricula, having regular assessments, and also support for supervisors. Many of the supervisors didn't require any training, and there was failure of how they were supervising perhaps their trainees at times. So standardising that was important as well. And then in 2010, a latter end with the Collins report, there was this balance between service and training. I don't think that's changed. That's still an issue. The service pressures increase, the training requirements increase, but how do you square that? It's really hard. And then trying to reduce the burden of assessments is something that also we're still trying to grapple with, and trying to have more formative assessments which drive learning rather than assessment for the sake of assessment as well. So what's changed? We know there's a huge significant change of medical education over the last few decades. We've moved from that didactic learning of just rote learning, lots and lots of lectures. I remember 96 muscles of your hand, you need to learn this, you need lots of rote learning. But hopefully that's changed to much more problem-based learning, case-based learning, and that emphasis of integration, which is so important, and competency-based curricula, and more of a spiral curriculum as well. The methods of assessment have changed as well, from those traditional exams, the 3-hour essays that were horrible, in which you just regurgitated your book rather than understanding and application of your knowledge, to much more applied knowledge around OSCEs, workplace-based assessments, and now entrustment professional activities, the EPAs as well. And greater focus on professionalism and behaviours and wider generic competencies, which I think as a practicing physician, those are the things that patients look at. Your knowledge, you might look it up on Google, but how you are with your patients, how you establish your rapport and your relationships is equally important, if not more important. And that impact of educational environment on learning and assessment, I think that's something that's become more and more apparent as an important driver of how people learn and how people assess. And also student and trainee well-being as well as trainer well-being. From COVID, lots of learning around trying to promote your own well-being and support, and making sure others are supported around you as well. And from the Royal College of Physicians, we've been trying to grapple with this over the years, understanding that there's an increasing gap between what doctors are trained to do and then the realities of modern day practice. We're not just clinicians now, we have so many different roles. Many of the times I'm a manager, I'm a teacher, I'm a kind of trying to, kind of conflict management, all these other things that perhaps I didn't feel I was trained to do. But how do we kind of better train our future generation of doctors? And also that shifting context. Mopin was talking about our aging populations with complex needs, the division between health and social care. It's still not coming together, and how can we kind of try and make things improving that, but also meeting the patient's demands? The patients don't just treat us like God anymore. They come back with so many questions, and they put forward complaints if they're not happy. So how do we try and meet the demands, both of the changing patient needs, but also the societal demands as well? So doing that, I think we need to consider how we train our future generation of doctors to meet these demands as well. So the goals for modern medical education have changed again over the years. So standardizing learning outcomes is important, making sure that that kind of wider experience, whether it's research, policy, education, leadership, management, all these skills should be instilled early. I had half a day of leadership management before I became a consultant, which was 10 years after I qualified. And that was nothing to prepare me to be a consultant and to lead on things which I was then leading on. So integrating things early is important, and all aspects, wider generic aspects as well. And again, that responsibility across from medical schools to teach the hospitals to the trusts, and making sure that those things are consistently flowing as well. And the development of professional values and behaviours, I think I can't emphasise that enough, that those are the areas where we see most problems with, where people are not professional and behaving in the right way. So getting those values and behaviours right is extremely important and key. And how does this impact on professional development and patient care? So the system-based curriculum, you'd hope, improves performance of healthcare systems, adapting professional competencies in that kind of acquiring that global knowledge, and that interdependence and interprofessional learning. I think lots of importance of how we work better as a team, how we learn from each other. We as doctors can't do everything, so making sure that the wider team is included and their knowledge and skills and expertise are taken on board and we're learning together. And I've mentioned about the generic professional activities, so these are interdependent essential capabilities. So all the curricula now, certainly in the UK and wider, are mapped to these kind of broader competencies and capabilities as well. So you've got your knowledge, skills and your behaviours in the centre, but then you have some of these other domains which were often overlooked, whether it's research, whether it's leadership, team working, health promotion, prevention. These things are equally important to make sure that these things are part of the training package and included within the curricula as well. And thinking about medical education standards and quality assurance and frameworks, we know that this is like a broad range of activities, so we need to make sure these things are in place to standardize training, standardize, kind of our way of delivery. And it includes, policies, standards, processes, both at undergraduate and postgraduate level to ensure these things are in place and driving the quality of training. And these standards, again, from our GMC kind of framework, looks at 5 different themes. There's 10 different standards. So thinking about how the learning environment can be more inclusive, can be more supportive. What educational governance do you need within organizations to deliver the best effective training? We need to support our learners, but importantly, we need to support our educators. If our educators are better supported, they can support our trainees better as well. And again, developing and implementing fair curricular and assessment frameworks as well. So some things to think through. And again, these standards are being updated this year. I've been part of some of those meetings. And in the next, sort of later this year, some of these updated standards will come about. And how does quality management work in practice? So again, we have our GMC, which is the main regulator. I'm sure in Pakistan here as well, you have the main regulator who sets the standards, but then the quality management on the ground and within the regions is done by medical schools councils, local education training boards, and then the quality control is local, part of universities, hospitals, individual trusts. And where does the Royal Colleges sit, or where do societies like yourself, the Pakistan Society of Internal Medicine, sit? For us, they sit alongside, so the medical specialty societies and the Royal Colleges help at all levels to drive the quality of education and training. And then the assurance frameworks, how does that work? So a lot of our standards are then looked at in cyclical visits, where we go and visit hospitals, where we go and see trusts, map it to that framework. We make sure that all of our posts for the training doctors is approved within the centres, and then we have active monitoring, where we go and see whether these standards are being met. If they've not been met and concerns around training have been raised, then they then go through an enhanced monitoring process where they have to produce evidence and change to demonstrate what they're doing to improve training, and then it goes around in a big circle to make sure that we're continuing to look at and actively encourage and support and drive the quality of training. So medical education over the years has changed in that focus, so that informative learning, that didactic learning which produces expertise, has moved along the way to have much more formative learning, where that's producing more professionals. And now what we're hoping for is that transformative learning and leadership, developing in that sense of kind of inquiry and change, and making sure that that clinician role is wider, encompassing all the different things which are needed for the modern day physician. And I can't not mention COVID, because of course that's impacted everyone globally, and that's had a significant negative impact both on undergraduate and postgraduate medical training, and we're still catching up with the delivery and the recovery period. Of course, assessment methods have changed, lots of different things have been impacted. Academic training, people's career choices have changed as well, and lots of shift of how we're teaching and how we're delivering education has changed. Some of those things have continued, I think, for the better, but things that we can build on over time as well. And some of the systematic reviews have looked at the impact of training, and many of them have looked at training requirements, so lots of impact on training requirements per se, extension of training time, career progression, as well as career choice. And lots of people have left medicine, sadly, as a consequence as well. and that kind of wider impact as well, whether it's mental health, education, well-being. We've seen lots of anxiety, depression, burnout, moral injury, sadly, and all these things are sadly continuing. So we need to be aware, kind of this and make sure we're proactive in providing that wider support to hopefully support their training and progression. So what are the current challenges in medical education? So the training recovery we feel must be prioritised, making sure we're maximising digital solutions, that attention to well-being, trainee recruitment in the UK. We have a workforce crisis at the moment and we're trying to manage, and we're trying not to pinch all the good doctors internationally, as Mopin was just saying, but I think that kind of exchange is important. Learning, cross-learning is important as well. And burnout is a huge issue as well, and we need to think about how we promote flexibility and wider portfolio careers as well. So there's certain trends in medical education now. We're trying not to double our efforts in medical school places, but there's no point increasing lots and lots of recruitment, but then people are not being retained. So we need to think about recruitment and retention. Learning has changed, so hybrid learning, integrated care, integrated curricula, thinking about mental health and well-being, and also how equality, diversity and inclusion is approached by our medical school as well as postgraduate places. And there's loads of new race equality targets, particularly in the UK. So I work a lot on around maintaining fairness in education, reducing the differential attainment gap, and trying to maintain all the educational pathway is fair, from recruitment to induction to support to assessment to curricula. And it's making sure it's a level playing field so that outcomes are maintained in that way as well. And lots of things around mentoring, peer support have been shown to be of benefit, exam preparation and support, and training our trainers to support our trainees as well. And addressing health inequalities, Mattis touched on that, so important to make sure we're readdressing the balance of support for our patients in the areas of greatest need. And again, leadership is a big part of that. System-based approaches is a big part of that as well. And different trends in learning. Our medical students, and certainly my children, learn very differently with synchronous, asynchronous learning short bite things. Nobody reads a book anymore. Everybody wants short pieces of information. So we need to adapt to that. And similarly, how we will train, loads of things around AI, as well as, ChatGPT and various other simulation things, which we need to embrace the change to hopefully move forwards with the times as well. Lots of different new professions. I didn't even know half these people existed before COVID. So lots of things to consider as well. And the last few things around assessment trends, so thinking about how we improve, that Miller's pyramid of how we're assessing, again, based on, kind of what is needed at the moment as well. And the same things go around different assessment methods as well. I don't know how you use workplace-based assessments here, but it'd be interesting to see your thoughts around that as well. So I know it's the latter few bits now, so what I was going to just mention is around some of the opportunities. So flexibility is key, improving our training environment, our educational offer, optimizing the use of technology, and embracing, kind of some of the, and also recognizing our faculty, because it's underserved. We're doing so much, but people don't recognize the amount of work that goes within. So recognition as well as training is important. So I think the future of medical education is around that, more focus on personalized learning, important student, trainee and trainer well-being, flexible working options, and also a focus on self-care and how you support each other, and that need for compassionate leadership as well. And that cultivating that compassionate leadership is really important, how we empathize, how we listen, how we connect with people and create that culture of support within our training environments, and different ways of doing that as well, noticing people, how they are around us, empathizing with them, understanding their needs, not just using this blame culture, we all get things wrong, but how can we learn from that, and providing that wider helping and support as well. And self-compassion, we're always very much supporting others, but we need to look after ourselves as well, and that kindness to us and supporting us. As my mum always used to say, you can't look after everybody else if you don't look after your own self. So self-care is important so that you can then give to others in that way, and getting that work-life balance right. I don't think I've got it right, but something I strive to work towards, and being kind to yourself is important. So I hope I've covered some of the intended learning objectives that I set out to do at the beginning. And thank you so much for your time and attention, and open to your questions in a bit. Thank you.